Great. Well, I'm going to kick it off. Good evening. My name is Stephanie Winters, and I am here to welcome you on behalf of the American Academy of Pediatrics Vermont chapter. And the goal of these forums, and this is our last forum, the last of 13, so we're happy to have been able to provide these all week. And the goal is really to provide factual information on the COVID-19 vaccine in adolescents, and to really have a conversation with families. So to that end, if you have any questions through the presentation, please use the chat box and type them in there, and then we will read them and get them answered during the question and answer period. And we are joined by a pediatrician and a family physician, and I know that both pediatricians and family physicians are really privileged to be a trusted source of information around vaccination, and COVID-19 vaccine is no different. Protecting children and adolescents from vaccine-preventable illness is a top priority for primary care practitioners, and they're ready to counsel families on this important decision. With that, I'll introduce Dr. Michelle Dorward, a family physician at Riverside Health Center, which is part of the Community Health Center of Burlington, and Dr. Stanley Weinberger, a pediatrician and the medical director of pediatric primary care at the University of Vermont Medical Center. So thank you both for being with us tonight, and I think Dr. Weinberger is going to kick it off, so I will hand it over to you. Thank you so much.
Sounds good. Thank you, Stephanie, and welcome everyone. I am going to share my screen. We have some slides that we'll be sharing and just kind of talking through, and then answering any questions that come up. All right. So this is the same slideshow that has been shown at the forums around the state. So we want to make sure we're kind of sharing the same information that other folks got, but of course our questions can take us wherever we need to go. And we'll just start with a little bit of an overview of COVID here in Vermont and kind of what the situation is. I think it's good while we're talking about COVID to think about, just how this has impacted kids and adolescents, because it's had a huge impact on all of us. And the same goes for kids, and it goes beyond just like the physical illnesses that come with COVID. And then there's a video from the AAP Vermont chapter president, Rebecca Bell, who's a pediatric intensivist, and then some information on the vaccine specifically for kids and adolescents, and then whatever questions we have. So Vermont, and this is information that you will find captured on the Department of Health website. So, it's information that you can get besides this talk, and it is updated regularly. But Vermont, we have had it better in terms of COVID than some places, but still a really significant amount of COVID disease. And this sort of breaks down COVID in Vermont by different factors. So you can see by age. And the group that we're talking about really specifically is that the 10 to 19-year-olds, because the vaccine is now approved down to 12-year-olds. And there's been 3,600 cases, roughly equal between male and female. And in Vermont, as in really all places across the United States, there's been a disproportionate number of cases in disadvantaged communities or communities of color. So they do break down cases by race and ethnicity here in Vermont. And we are similar in that pattern to other places across the country. In terms of school-age kids, there has been, these are a number of cases per week, and it's been, roughly around 100, peaking in early April to 280 cases a week, and then kind of coming down. But it's been a steady amount of cases. And they, sort of peak. You can break it down further. These are rates per 10,000. And there have been peaks and valleys, and they do mirror how COVID is outside, so that when we have peaks in COVID in the community, the kids in the community also can get COVID and bring it into the schools. But we've been lucky in that the case rates have been relatively low. And the, when we talk about COVID severity, kids also in general are less likely to have severe COVID disease than adults, although they certainly can get severe disease. Across the country, there's been 300 deaths in children and adolescents due to COVID, which puts it in the top 10 in terms of causes of death this year. Those have not hit Vermont, thankfully. We're a small state. But in this, there's been some youth forums, and Stephanie, you could correct me if I'm wrong, but I think Catherine was one of the folks who participated in a youth forum with the governor. But I think
Yes.
I just find this quote really eloquent, talking about how it's been a real challenge above and beyond getting sick with COVID. And I see that, my kids are younger, and it's been a challenge on them. But as I talk to the middle schoolers and teenagers that I take care of, it's been particularly isolating, and they've had less in-person school than the elementary schoolers. And it's been a real challenge. They've certainly shown incredible resilience, but it's been a long year of missed events and missed connection. And so I think that is important to acknowledge. It's one of the reasons this is exciting, that we have vaccine that is safe and is now approved. We are to the point, this is a message from Becca Bell. As I said, she's one of our pediatric intensivists, so she cares for kids in the ICU here at Vermont Children's Hospital, or UVM Children's Hospital. And I think she just speaks eloquently to the vaccine and what we know about it, and kind of put some context, and then we'll go through a little further in those points. So,
hi there, I'm Becca Bell. I'm a pediatrician in Burlington and the current president of the Vermont chapter of the American Academy of Pediatrics. And I'm just going to take a few moments to talk about how excited we are as pediatricians that the COVID-19 vaccine is available for young people now. So I'm a pediatric intensivist, which means I take care of children in the pediatric intensive care unit at UVM Children's Hospital. And I take care of infants, children, and adolescents who are critically ill or injured. And so vaccines are something that have always been really important to me because they help prevent a lot of the very serious illness I sometimes see in the ICU when children are too young or haven't been vaccinated against a vaccine preventable infection. And when I think back to last spring when everything was shutting down, and I was working with some of my other ICU colleagues who care for adults, and we were really worried about the number of ventilators and the number of hospital beds. If you had told me then a year ago that we would have a number of safe and effective vaccines that in trials, when tested on tens of thousands of people, prevented people from not just dying, but even becoming seriously ill enough to even be in the hospital, I don't know if I would have believed it. It's amazing how effective these vaccines are. And a lot of people are wondering, how are we able to get these vaccines so quickly? It seems like quite a feat. And, in pediatrics, we're used to vaccines taking a little bit longer. And part of that is that there's a lot of competing interests in terms of what type of research and technology gets funded, right? Lots of competing interests there. And when we test vaccines on other types of infections, usually those infections aren't as common, aren't as prevalent. And so it takes a while to get all that data. But with COVID-19, as we all know, the world stopped last spring, just completely stopped. And the biggest priority that everyone had in the world was stopping this virus. And what that meant really was having safe and effective vaccines. That became the top priority. And so every effort was turned towards that. All this funding was turned towards that. And a ton of collaboration happened in order to make this possible. So I want to talk a little bit about the vaccines that you all qualify for, are eligible for, or will be soon, and that's the messenger RNA vaccine. So that's the Pfizer and Moderna vaccines. So this is a technology that's been in use in cancer therapies, and also scientists have been using it to study vaccines for other infections. And so when the world was told what the SARS-CoV-2 virus looked like, that was something that was shared with everyone, people got to work. And so they used this technology that already existed, and they made it applicable to the SARS-CoV-2 virus. And because there was so much funding going towards this, they were able to make this happen on a little bit of a quicker timeline than usual, but all the steps were there. They went through every single step. And because COVID-19 is so prevalent, when they did the efficacy trials to see if it worked, and they gave vaccine to some people and a placebo to other people, they saw very quickly that the people who received the vaccine weren't getting sick from COVID-19. And the people who didn't receive it were getting sick. And that data was collected so quickly that they were able to get a pretty definitive answer that these vaccines are really effective. And one thing that I think is so interesting about the mRNA vaccine is that it really gives your body instructions for how to make a protein that looks like what's on the virus. So what do I mean by that? So when you get the vaccine, this mRNA is like a little piece of instruction, or I almost think about it like a handwritten recipe that's sort of passed down in your family, right? You have a piece of paper with a recipe, and then these are instructions. Then your cells can make, based on the instructions, can make a spike protein with that. Then once it's made, recipe goes away, and the mRNA, it just kind of disintegrates and disappears. And then what you have is this harmless spike protein that's not the virus, but is similar enough that your immune system can look at it, recognize it, and get ready for it in case they ever see the SARS-CoV-2 virus. And this is really important because this is what will stop the virus from replicating throughout your body if you're exposed to SARS-CoV-2 and making you very sick. And one of the things we know in intensive care medicine is that these viruses, SARS-CoV-2 in particular, the virus itself can cause a problem in your body. It can cause direct injury and illness. But the other problem is on the other end, when your immune system is trying to fight off that virus, that battle that happens can create a ton of inflammation and a lot of problems and a lot of illness. So it's that back and forth between it's the virus and your immune system. When you get exposed to the virus, when you get sick, that can make you really sick. Now, in someone who's been vaccinated, instead, their body sees the virus and their immune system's already ready. They already have the antibodies. They recognize it really quickly before the virus can kind of get out of hand. And they've got the cells ready that they know they need to fight off this virus. And that's why people aren't getting very sick. They're not dying. And if anything, they might have a mild cold after being vaccinated. And that is what's so amazing, is that these vaccines give your cells this recipe for how to create this spike protein. Your body then, your immune system then learns it, understands it, recognizes it, and gets ready for it. So when the first authorization happened, first with Pfizer in December, I was one of the lucky ones to get vaccinated pretty early. And as you can imagine, there were lines of doctors and nurses and other healthcare providers who were just so excited to get this vaccine. I mean, it was emotional. I felt emotional getting the vaccine for the first time, knowing that I was protecting my body. And then I got my second shot in January and had the expected, many people kind of feel crummy the next day because they have that, they can sense their immune system sort of recognizing again this spike protein and sort of revving up for it. And then felt fine after a day. And it's just been so amazing seeing my rest of my family and my friends and my colleagues and everyone I love getting vaccinated. My own children are too young right now. They don't qualify, but I am going to be so relieved and so grateful when the vaccines are approved for their age group, and they will be first in line. So I just wanted to spend a moment just to really let everyone know that, we're living in this really, really challenging time. This virus has really wreaked havoc directly and indirectly, and it's affected all of us. But there is this really bright spot, and that is these vaccines they're really effective, and they're really doing what we want them to do, which is to keep us from getting sick. And we really want you to ask questions. If you have questions about the vaccine, we're here for you. Pediatricians are really excited that the people we love, our patients, are going to get vaccinated soon. And we're happy to walk you and your family through this process and work towards getting our communities healthy and getting back to doing all the stuff that we love doing. So thank you so much for listening, and please feel free to reach out to your pediatrician and reach out to us, and we're happy to work with you on this. Take care.
All right. Yeah, so we're going to kind of move to talk a little bit directly about the vaccine. This was some material that came, I think, originally from Virginia. Yeah, it says the Virginia chapter. But right, when I've talked to teens, because even before this vaccine was authorized for the 12 to 15 age group, it was approved for those 16 and older. And a lot of teens talked about it in this way, that it helped with stress, taking away worry of getting themselves sick, their friends, their family members that they care about, as well as allowing things to get a little bit back towards normal. I'm going to turn it over to Michelle Dorwart, who is going to talk us through this next section a little bit.
Yeah, hi, everyone. So yeah, I think like Dr. Bell mentioned in her video, we recognize and know how many questions parents probably have, and we want people to have this forum to be able to talk about it. Of course, in primary care, we're more than happy to talk about it in our offices as well, but we're really grateful to have this forum as well. So we all want to be able to make informed and knowledgeable decisions to do the best thing for our children. And so that's what we're here for, to talk about. So one COVID vaccine was authorized for teens, 16 and older, back in December of 2020. We all have probably heard about that. The Pfizer vaccine is the one. And then that same vaccine was also recommended for use in youth ages 12 to 15, just a couple of weeks ago on May 12th. So go to the next slide, please. Thanks. So Dr. Bell really kind of outlined this very well in her video. But basically, the COVID vaccines work just like other vaccines that we give. in clinic or just generally. Basically, it allows our bodies the opportunity to make to kind of see part of an infectious, a virus or a bacteria. We see part of it, and then we make a response to it. We develop these antibodies, which I kind of think of as being like security guards. So our body kind of gets a chance to make these antibodies before and without actually getting sick, such that when the time comes, if we are exposed to a virus or some type of infection, then our body knows what to do and can really take action and fight against it. So that's how the coronavirus vaccines work as well. And we know that after vaccination, your child is going to have less of a chance of getting COVID at all. Or if they do get an infection, they're less likely to be very, very sick from the virus. So what are the types of COVID vaccines that exist? So there's 3 different vaccines that were given emergency use authorization in the United States so far. There are two-dose vaccines, the Pfizer and Moderna. The Pfizer, as I mentioned, is the one that is currently authorized for youth, for anyone ages 12 and older. And then there's the Johnson & Johnson is the other one that has emergency use authorization so far, and that's a single dose vaccine. But again, the Pfizer one is the only one that currently has authorization for those 12 and older. Just a note about the Johnson & Johnson vaccine. So this was, widely publicized. So I'm sure many people have heard about this, that the one-shot vaccine, the Johnson & Johnson, was paused temporarily a couple of months ago to look for possible ties to a rare but very serious blood clots that seem to be happening among those who received that vaccine. So it was the, administration of that vaccine was paused so that the FDA could review all of the data and kind of know, hey, what is going on here? Do we need to be worried about this? Do we need to just stop using this vaccine altogether? So the data were reviewed very thoroughly, and the FDA was able to resume use of that vaccine once it was realized that the risk of developing the clots was very, very low relative to how many people were getting the vaccine. And I think, something really important about that pause, while it might have seemed alarming, I think it's very important and also heartening to know how closely these vaccines are being monitored. So, to know, hey, if something's happening, there's a lot of people watching, really kind of keeping very close scrutiny of these vaccines. So I think that's an important thing as well. So basically, when we're thinking about any type of intervention, we want to weigh the potential risks versus the potential benefits. And with the Johnson & Johnson vaccine, after kind of reviewing the data, the FDA determined that the potential benefits, the actual and potential benefits, outweighed the actual or the known and potential risks. And that's why they said it was okay to carry on using for those 18 and older so far. So how effective are the vaccines? So research that we've had so far shows that all of the COVID-19 vaccines that we have are highly effective at stopping people from getting COVID-19. The vaccines also help to prevent serious illness, hospitalization, and death. So if someone gets COVID-19, they're much less likely to get very sick from it. The question a lot of people have is, how long are the vaccines going to be effective? Are they going to need a booster dose? And we really don't know that yet, just because, really the vaccine started to be studied last summer. And so there's ongoing data that's being gathered over time, and we're going to continue to learn more and more as time goes forward.
One thing I would just add, this is Stan Weinberger, is that these vaccines now have been approved and given in the United States since December. So we've got 6 months and millions of doses of vaccines administered. And what's exciting is, there was really good data from those original vaccine trials in terms of how effective the vaccine was, how well it protected against any type of COVID, and in particular, how well it prevented serious hospitalization and death. But what's really encouraging is now, there's 6 months of actual real world experience. And so we follow the literature, and there's reports ongoing about that. Yeah, this works not only in a trial, but in the real world setting. Because remember, now there's different variants, and things are changing, but it still is highly effective. And we're learning information, that we didn't know initially, right? Like, how well does the vaccine work in pregnant women or women who are lactating? And so the amount of information we have now is great, and just keeps expanding.
Yeah, absolutely. That sort of, I'll tell a personal story, which is that I am currently breastfeeding my daughter and got vaccinated in December. And I personally am participating in a study in which they're sending kind of monthly surveys, and basically just asking questions about my health, the health of my baby, my breast milk supply, all of these things. And so that's a study. And also there are studies of, just all kinds of different studies, but there was another one of lactating women where they were actually like sending in samples of their breast milk to be studied. So it's really, there's so much information that's coming in and so many smart people studying these vaccines. So it's really pretty amazing. Go to the next slide, please. So another question that a lot of folks have is, is one vaccine better than the others? And certainly, again, there's only one vaccine currently that's available for those 12 and older, but generally speaking, for adults, for example, who could potentially choose between the vaccines, really, they're all very, very effective, similarly safe and effective in protecting against severe illness and death. You'll hear a lot of different, percentages like, 95%, 65, all of these different percentages, and you're thinking, gosh, which one is actually the most effective? And we don't know that information because the vaccines were not directly compared to one another. They didn't do like head-to-head trials of the vaccines. So they weren't necessarily, and they also weren't studied at exactly the same times. So some of the earlier vaccines that came out, like the Pfizer and the Moderna, were studied before the variants were widely circulating. So you might hear, like 95 to 100% efficacy. And then, another one might seem lower, but really they're all really remarkably effective. And we don't know exactly the differences in efficacy, but they're all very effective and similarly effective. Which ones, have better side effects or worse side effects? Really, they all also have potentially the same side effects. And those side effects are mostly from our body's immune system kicking in and developing antibodies. So when our immune system makes an antibody response, it makes us feel crummy, as Dr. Bell kind of talked about. And that can happen with any of the vaccines. So how do we know that these vaccines are safe for youth and young people? Again, they're being really widely studied around the world, and millions of people across the world have been getting the vaccines. The studies have been ongoing really over the course of many months, going down, to ages 12 and up, and tens of thousands of volunteers participated in those studies to be able to kind of learn about the vaccines and how they work in youth and also adults across the world. And as we already talked about, the vaccines continue to be monitored very closely. And the CDC is basically saying that these vaccines will be the most intensively monitored vaccines in US history. So really there's so many people, the world's attention is really on these vaccines. And so I think that can be reassuring to us in the sense of knowing, people are watching, scientists are watching, the world media is watching. So we know that there's a lot of attention being paid to these vaccines. And I think that, to me, that gives me a lot of confidence in them. I was already feeling confident in them, but that just adds to that confidence. So what about side effects? So some people don't have any side effects, but some people do. The most common side effects are a sore arm. A lot of people get a sore arm in the site of where they got the vaccine. And then other symptoms that a lot of folks get are really things that you might think of as like flu-like symptoms. Some people will get a fever and chills, headache, muscle aches, fatigue, nausea, just kind of feeling crummy and run down. So a lot of times, and this is more likely to happen if for the 2-dose vaccines, a lot of people notice more side effects after the second dose. Sometimes people notice the same side effects after both doses, but the second dose does tend to produce more side effects, it seems. And really, when people are having these side effects, and when I personally had those side effects, I thought, gosh, this is so great that your immune system is working. My immune system is working to make antibodies. It's like obviously not fun to be in bed with like a headache and side effects, but at the same time, it shows, that it's working, which is really amazing. And the good thing to know is for most people, the side effects, a lot of people, they last like 12 hours, but some people, they will last like 1 to 3 days and then go away. And how do we, when are we kind of fully vaccinated? So after the 2-dose vaccines, the Pfizer or the Moderna, we consider someone to be fully vaccinated 2 weeks later. That's about how much time it takes for your body to produce the necessary antibodies to be considered immune. For the 1-dose vaccine, the Johnson & Johnson, immunity, it takes up 2 to 4 weeks. So 2 to 4 weeks after getting that dose, you can be considered fully vaccinated. Another piece of information is that the COVID vaccines are free. Whether or not you have insurance, you cannot be billed for them. So that's also a really great thing. Vermonters under age 16 can now get vaccinated, which is really wonderful, as we're talking about. So 12 to 15 years old, we have the data, we have clinical trials to show that the vaccine is safe and effective for people in those age ranges. And we can also look forward to, hopefully in the near future, being able to vaccinate children as young as 6 months of age. That there's ongoing trials that are happening right now. So that's really, really exciting. And then there was this question about, can we get other vaccines at the same time? And initially they were kind of, the CDC was, or I think the CDC, was recommending being really cautious about like, oh, should we give another vaccine at the same time as the COVID vaccine? And they were saying, hey, let's be cautious and not do that. But now that we have more data and more information, we think it is okay. And we have evidence to suggest that it's reasonable and appropriate to give other vaccines at the same time as the COVID vaccine, or even within, a few days before or after, to children or adolescents. Maybe if they're due for another vaccine, it's okay to give it at the same time as their COVID vaccine. And then I'll turn it over to Dr. Weinberger. Yeah, go ahead.
Yeah, so I can jump in here. So in terms of sign up, how do you sign up? Many of you may know this or have been through it on your own. The vaccine is now being offered in many different places, a number of pharmacies around Vermont, as well as these mass vaccination sites. And now there are more and more pop-ups, sort of walk-in sites. But the main place to go is healthvermont.gov, my vaccine. That's the Vermont Department of Health website that has the vaccine options. And you go and register yourself, and then you register your child as a dependent. And there is a consent form that you fill out. And there are, I should say, I was just on there today looking, and there are a number of pop-up sites, and they'll state very clearly, I think all the sort of walk-in pop-up sites at this time, as I was scanning the list, are for folks 18 years and older. And that's, in part because those 12 to 7 up to age 18, really the only vaccine they can get is the Pfizer vaccine. There is a phone number also on that webpage. And so that allows you to sort of do it by phone and bypass the computer, as well as to get an interpreter. So the best way to guarantee a dose is to register in advance. They are setting up clinics in the schools. And so as you go on there, it'll list, a number of different places you could get the vaccine, including some schools. And so you can register. Many of the school clinics there having some ability to get the vaccine the day of, if you hadn't registered, provided you're able to give consent for your teen. But that will likely depend on supply and how many people have registered. Yes, so the vaccines only happen with parent consent, and schools will be, have a general permission form. That's the standard Department of Health permission form, but there's also the ability for parents to consent over the phone should they want to do that. But registering in advance is probably the most effective way. And there is a host of other resources out there. Our own Vermont Department of Health, www.healthvermont.gov, has a ton of information. It's really regularly updated, both about COVID in Vermont. Those graphs at the beginning were from this website, but about the vaccines. Healthychildren.org is another great site that's has a bunch of information from the American Academy of Pediatrics, and then the CDC as well. And I think that is kind of the end of the questions. So I may stop the sharing. And I saw there were some questions in the chat. And so, these are Stephanie Winter's comments in the chat.
Yeah, thank you both very much. That was great. And I did put in some links in the chat as Dr. Weinberger and Dr. Dorr were speaking. So there's the COVID dashboard in the chat, so you can sort of check the statistics for yourself. There's the COVID-19 vaccine dashboard, which now includes the 12 to 15-year-olds, and they've really included a lot more information. So you can check on that with that link. And then I also added the link to the actual school-based or community-based clinics, so you can look to see where those are happening in your community, or wherever. You can certainly cross town lines to go to a community clinic. They're listed on the health department website where you would make an appointment, but you can also look here. So with that, I would love to open it up for questions. You can feel free to chat them in the chat box, or we could unmute. You can unmute yourself and ask questions. Maybe I'll just kick it off with one question that we've gotten from other forums that we have held. If no long-term studies have been done on the mRNA vaccines, and specifically on children, how do we know these vaccines are safe in regards to long-term side effects?
Right, great question. And yeah, we know, sort of the information that we know from a couple of sources, and part of it is that this technology is not totally new. So it's been used in other vaccines and in other settings like cancer treatment. And so, there's a little more history in terms of that, that we know about this. As far as this specific vaccine, what we know is, for all folks, the 6-month history with the vaccine, as well as, the now 15-month history or 14-month history with COVID itself. And the thing I also try and sort of keep in mind and keep in context, is COVID itself. There's the worry about the vaccine, and we do know, some information about mRNA vaccines. It's not totally new technology, but the other thing is, what are the long-term effects of being infected itself? We know that, a number of folks, adults and kids, can get sort of long haul or long-term symptoms. We know that, a number of kids in particular have experienced some real systemic inflammation symptoms, like you may have heard of the multi-system inflammatory disease syndrome in children, or MISC. And so I think, there are certainly things we don't know about the vaccine or the illness long term. I should point out, though, that, that the vaccines we have in general, and this goes for not just speaking about the mRNA vaccines, it's not the case that we generally find out about bad side effects decades later from vaccines. Most of the vaccines that we have in our routine childhood series have been around for decades and decades. And generally, the side effects are pretty apparent in trials early on. And so it would be distinctly unusual to have some sort of long-term side effect show up years later. That would just be, not something we see with the way vaccines work in general. So I think, there's unknown, but the risk is quite low.
Yeah, and I'll just tack on to that by saying, basically exactly what you said, which is that when we think of vaccine side effects, we think really of 1 to 6 months, not 10 to 40 years. And particularly with the mRNA vaccines, you think of, they were really, there was all the information about, they have to be transported at such low temperatures. And that's really speaks to the fact that mRNA is very unstable, and it needs to be stored at this low temperature because it degrades very quickly. So it degrades like super duper quickly. Once it goes into your body uses it as, the recipe to make this spike protein. And then our bodies have enzymes that break down mRNA, that because we make mRNA in our own body. So we already have an enzyme to break it down. And the other components that are part of the vaccine that kind of help carry it into our bodies also are metabolized very quickly. So really, after vaccination, you kind of make antibodies, and then the components of the vaccine leave. And the only thing that's remaining are the antibodies. We will have excreted all of the other components of the vaccine within days. And when those antibodies then are there, our body has no way of knowing, like, was this an antibody that was made from a vaccine, or was it an antibody that was made from an infection? So it's not like, in 50 years, my body's going to know that I had the COVID vaccine because I have this fancy COVID vaccine antibody. It's not like that. It's like an antibody is an antibody. And so yeah, really long-term side effects. I think, again, all eyes are on this vaccine and these vaccines, but the kind of biologic plausibility of a longer-term side effect is exceedingly low.
Great. So we have a question that came in. I know it looks like this just came out, but can you speak to the recent investigation yet from the CDC regarding youth experiencing myocarditis, possibly due to the vaccine?
Yeah, great question. We were just talking about this before everyone jumped on. Yeah, it did just come out, and there's not necessarily a ton of information yet that I could find through the CDC, in terms of what they're reporting. It sounds like there's an ongoing investigation. So they've seen a few cases of myocarditis, which is inflammation of the heart, that have happened in folks who had recently gotten the COVID vaccine. And it sounds like, and so I wasn't able to find exactly numbers of how many, and they were reporting the cases as generally mild. And so I think we don't know yet. And part of the reason it's hard to know is myocarditis. There's a certain background rate of myocarditis that we see. And so it's always hard to know when you have really rare events, is this something that happened to happen around the time of the vaccine, or is it in some way related to the vaccine? And that can take a little while to sort out, particularly as, a great example is the Johnson & Johnson vaccine, right, with the blood clots. One of the things, you have to do is sort of collect all the cases that you can find and sort, to better establish, is there a pattern and how frequent is this? There's the other thing that I just think about when I think about that is coronavirus itself, the natural infection, not very commonly, but certainly can cause myocarditis, both as a effect of this multi-system inflammatory syndrome in kids. That certainly has a component of inflammation of the heart or myocarditis, but also it seems to cause rarely, but some low level or just sort of isolated myocarditis. And some of that data, it's not yet clear how prevalent that is, but there was a number of athletes at the college level and professional level who got COVID and were intensely studied, and they were found to be some cases of inflammation. And so, this is an issue that I'm glad they're looking at, and it just came out. So we will find out more, but
Great. Thank you. Dr. Dorr, do you have anything to add? And then I see Colleen has a question.
Yeah, no, I don't think I have anything to add to that, but yeah, more to come, sounds like. Go ahead, Colleen.
Hi, thank you. This has been really helpful. I'm curious as to how the dosage for the children is the same or different for the dosage at the adult. Is it manufactured differently? And if so, how is it managed so that we know that the child is getting the size or the dosage that they should be getting and not accidentally get an adult dosage?
Great question. I believe, correct me if I'm wrong, Michelle, I believe it's exactly the same size, the exact same dose. And to put that in context, the flu vaccine, there is a smaller dose for kids under 3, but 3 and up through adulthood, it's the same dose. And a number of, so there are some other vaccines that are that way. So they're not necessarily dosed in the same kind of weight-based way that we're familiar with, right? Like medicines that we give to our kids often are, pretty strictly weight-based. So I think it's the same dose. Great question.
I think so too. And I have heard about, though I can't speak super well to this, but I have heard that there's been some question about whether, a lower dose would generate a good enough immune response. And I think that is kind of being studied, but yeah, I agree. I think right now it's just the same dose for all who are receiving the Pfizer vaccine, for example.
Great. Yep.
Were you about to, it looks like Paul
I was just going to read the question. Yep. The question is, I see many online stories about successful treatment protocols using well-established medicines, which either prevent COVID or mitigate the severity of COVID. Why, therefore, has the focus been on a vaccine instead of focusing on well-established medicines that have proven to be safe and effective? Wouldn't it seem reasonable to use well-established medicines instead of using a new vaccine which has no long-term side effects?
I think that is a really interesting question. I guess I'm not sure exactly which particular medications you're referring to, Paul. And I think, I would say that there are many studies related to COVID ongoing around the world, whether it be related to COVID vaccines or treatments or that kind of thing. I think if we're thinking of, a risk-benefit analysis, if to give someone a medicine, like a pharmaceutical, which has potential side effects versus giving someone a vaccine, and we're thinking of either of these things being given prophylactically, the side effects that we generally see related to vaccines and sort of the long-term risks and potential harms related to a vaccine are generally less than the side effects related to like a medicine, I'm thinking like hydroxychloroquine, which was very popular in the media as being, a potential way to prevent COVID. Certainly has way more side effects than a vaccine. And also, I would say that, the hydroxychloroquine really hasn't panned out in the way a lot of people hoped it would. So really has not been effective in preventing COVID. So I don't know if you have other specific questions about specific treatment protocols, but that's what I would say is, if you're thinking of risk benefit analysis, then the risk of vaccines is much lower, generally speaking. Dr. Weinberger, I don't know if you have anything to add.
Yeah, no, I mean, that's generally it, that it is true. I mean, there was a lot of focus in terms of the research on vaccines. And that's often right, because preventing is often better than treating once you're starting to get injury from a infection. But what is out there hasn't been quite as, from what I've seen, hasn't been quite as promising as you would expect. And things like, some of the steroid medicines like methylprednisone or dexamethasone, also have pretty intense side effects as well. So it's, I would imagine that would be an ongoing, avenue of study, but usually prevention is better. And the decades-long history of vaccines, they tend to have much fewer side effects than the medications. Stephanie Winters had just put in the chat a report around the myocarditis, that thus far the rates that they're seeing of myocarditis following COVID-19 vaccine have not differed from expected baseline rates. And so there's been somewhere around the order of, I think, 4 million doses of vaccine. Am I thinking of that right? Sometimes I get confused about the number of folks 12 to 15 having received the vaccine across the country. And so it looks like they're continuing to study it, but they haven't seen necessarily, like, the number of cases is about the number of cases you would expect to see in that number of kids that age in a given year, or, in a given time period. So.
Sorry to cut you off. One other just quick note in response to Paul's question is, if you're thinking of what is a very effective way to prevent something, it's actually to have your own immune system do the work. So like vaccines really kind of teach our immune system such that in the future, anytime, whether it be in 2 weeks or in 2 years or 20 years, if the immunity lasts that long, which again, we don't know yet, but generally speaking, for the duration of the immunity of a vaccine, our immune system, our own body, is doing the work. Whereas theoretically, if you were having to take a medicine in order to prevent something, you'd be having to take a medicine every day to keep preventing the illness. So kind of, it's like the whole teach a man to fish kind of thing. So it's basically like teaching our immune system to do the work. And that's better than having to take a medicine for it.
Great. Other questions? Feel free to unmute yourself.
Those are great questions. I mean, yeah, these are all the questions that we should be asking, right?
Right, and I've been to as I said in the opening, this is our 13th forum, and I've been to half of them, and I found that families are really just looking for information and to be reassured that they're making the correct decisions for their families, and so that's why we wanted to have these, and these are really important questions.
Let's got another one.
Go ahead. Yeah. Oh. Were you surprised the American Academy of Pediatrics, AAP, officially recommended the COVID vaccine, given that data for post-vaccination efficacy effects for even 12 months has not yet been reached?
Not really. In part, I think, Paul, the sense that I got, is just that this has been so devastating, the number of thousands of kids who have been hospitalized. I mentioned the deaths in kids are around 300, which is significantly more than a typical flu year where you might have 150, 170 deaths in kids across the country. And just, the impact. One thing that I appreciate about the AAP, and just about primary care practitioners in general, right, is the focus on the whole kids. What we've seen is with our societies shut down and our schools shut down, and just the stress on families, it has really, it's been a huge worry about lost learning, kids getting behind, mental health crises, suicide rates. And so there's really a lot of fear of just the overwhelming impacts of COVID, because on the face of it, it seems like, kids are not getting as sick as adults, and that's true from COVID. But the AAP has been very tuned in kind of throughout this on the impact on kids and families in their day-to-day lives. So I'm not that surprised. Also, the data from adults has just been so overwhelmingly good. I mean, these vaccines, I sort of compare this in my head to the flu vaccine. The effectiveness of this vaccine is so much better. And there, for its safety, I guess I'm not that surprised.
I'll read Paul's next comment here. So he says, I appreciate all your comments. I'm the parent of a 17-year-old whom I love dearly, and I keep going back and forth of whether she should get vaccinated or not. The big decision that leaves little room for making error. I totally hear you, Paul. I think that's, thinking back to I don't know, maybe September or something. And we're learning all about these vaccines, and there's so much so much out there, and kind of information abhors a vacuum, just like nature abhors a vacuum. So there's just everybody trying to fill in that information with true or false information. And it can be overwhelming. So I personally was very lucky that I have a very close friend who's a biochemist and who herself was a vaccine trial participant. And so she was able to remind me, because I'm oh my God, mRNA vaccine, all these things, and trying to remind myself of, back when I was in biochemistry in med school. But she reminded me about the fact that, our bodies have these enzymes to break down mRNA. Our bodies are really capable of dealing very well with vaccines and their mechanisms. And, as we kind of alluded to before, the mRNA vaccine has been around, or the mRNA technology has been around for quite a long time too. But yeah, no, I think that's why we're here, and kind of knowing how important it is to parents to kind of make the right decision for your child. Every day you're trying to make hundreds of decisions for them, and this is a big one. But thanks for asking your questions. Other questions?
That's great. No, I was just going to say, and Paul goes on to say, thank you for all your hard work, by the way. Your dedication to alleviating suffering is noble. It's very kind. Anyone else? Colleen, I see you're unmuted. Do you have another question?
I've got several, but
go ahead.
I guess I have a young daughter, and she's entering puberty, and that we are just in such unknown territory with the virus, with the vaccine. So it's a dilemma. It is just this young girl is beginning to develop, her body's growing, hormones, and I have a skepticism of how can we possibly know? We just haven't had the ability to do any lengthy tests. Other children's vaccines, how long do we typically get to test vaccines before we start administering them with our children? And I'm saying this not from a place that I'm against vaccines. I'm just trying to understand, because I certainly don't want her to deal with the virus.
Yeah, I think that's a really good point. I mean, I think the pandemic, so I'll say aloud, because even though it's not a really positive thing, but the pandemic did allow for what would normally take many years to happen in a much shorter amount of time. And it's not because corners were cut or, they skipped steps or anything like that. It was like the virus was spreading just dramatically around the world. And so normally if you're testing a vaccine, you give the vaccine dose and then send the person out to potentially get exposed out in the world. And that might take a year, it might take a long time because whatever virus infection you're trying to vaccinate against maybe isn't spreading that wildly. But in a pandemic, it's like, oh, you can go out and get exposed tomorrow. And that kind of was how it could go much more quickly. But nonetheless, like I said, they didn't skip steps or say oh, we're not going to check on this certain thing because we want to just do it quickly. It was just the widespread nature of the virus that allowed it to be developed quickly, but it still was tested and studied in a lot of people. And then another thing, I think you're kind of referring to questions relating to, reproductive health, maybe related to the vaccine. And I guess this can get really into the weeds. So, but I'm happy to answer if you want that and kind of go there. So there was this kind of theory that maybe the antibody would attack this part of the female reproductive system that allows for the placenta to develop. And so in doing that, then females would become, infertile. Well, that isn't the case because, again, it's the antibody that they're saying would do this. And if that were the case, then folks who've gotten coronavirus who would also have the antibody would be infertile, right? We would be seeing a dramatic uptick in infertility around the world. And that just hasn't been the case. But it seems oh my gosh, the last thing I want to do is cause that to my daughter. But really, that hasn't been the case. And then the other kind of part of that is, the protein that they're kind of saying is the protein that leads to placental development that's being attacked by the vaccine is this tiny, tiny, tiny shared sequence of 5 peptides, which are components of proteins. So it's a very small sequence that this theory says that the antibody attacks, but it's such a small sequence of proteins that it's not even enough that an antibody could recognize it. So antibodies recognize proteins, but they recognize proteins of a certain size. And this protein that theory is talking about is not big enough to be recognized by an antibody. Does that make sense? So it's like I said, it gets into the weeds, but whoever thought of that theory really thought hard about it to make it seem plausible. And I think, so speaking again of, that brings me to plausibility. And so you think gosh, this hasn't been around that long. And I don't know, what's going to happen in 2 years or 10 years or whatever. And that we really have to kind of think of what is biologically plausible. So yes, maybe in 10 years, whatever will happen. But is that really biologically plausible? How likely is that to happen? And the answer is very, very, very unlikely. Because of what we know about how vaccines work, how mRNA works, and kind of how these mechanisms in the body work, we know that that's, the chance of infertility as a result of this vaccine is very implausible. Hopefully that's helpful. And I don't know if you have anything to add, Stan, to that.
No, thanks. You explained that really well.
I think as a non-clinical person here, for me, it's helpful to hear also that, you've talked about it a little bit, but that the mRNA technology is not new. And so that has been studied for a very long time. So that's really interesting. And then there was another part that there is some, I think Ashley Miller, who's a pediatrician in South Burlington, got a question about the change in women's menstrual cycles, that sometimes after the COVID vaccine that can happen. And I'll let you guys answer, but she sort of said, first of all, adolescents' menstrual periods are very irregular anyway. and talked about sort of when you don't feel good, that those things can have an effect. So can you talk a little bit about that too? Either one of you.
Sure. Yeah. It is true. Right. Teens' menstrual cycles tend to be quite irregular. And I had heard, some of the infectious disease folks talking about this as well. So you have a background rate of menstrual irregularity in the age group in which they're giving the vaccine. And so it's hard to sort of sort out how much is this just sort of the same rate of background menstrual, irregularity. And the trials themselves asked about a host of different side effects. They did not specifically study, the way that you would ideally find out about this, right, is you have however many thousands of folks, some of whom get the placebo and some get the vaccine, and you study. And one of the things you very specifically look at is what's happening to your menses, and you get a sense of, right, what's the percentage of folks who got the placebo, and what's the percentage of folks who got the vaccine, and is there a difference? And so we don't know that. And so you're left sort of trying to sort out, does this seem similar to the background rate of menstrual irregularity? I don't know if you have more to add.
Yeah, no, that's interesting. I hadn't really heard about that as being an issue, but it kind of makes sense related to stress. There is in adults, something that comes up is screening mammography. So after getting the COVID vaccine, it's possible that women will get enlarged lymph nodes in their armpit, and that can lead to false positive, can lead to something to show up on the mammogram because there's an enlarged lymph node and that can show up. So it's kind of being recommended to delay screening mammography. So just similarly, the immune system kicking in, creating this stress response, and a stress response can have other effects like irregular menses. Yeah.
Great. Well, do we have other questions? I know we're over time, which is fine. I'm cognizant of people's time, but would love for people to unmute if they have more questions. Well, great. Well, thank you all for being with us. And I want to thank all of the families for being with us tonight, and Dr. Weinberger and Dr. Dorwart for presenting and leading us through this. But the questions were really awesome. And again, if you have questions, reach out to your medical home, your primary care physician, and certainly ask your questions, because no question is too big or too small. Definitely no question is silly, and they really want to help guide you through this process. So thank you all so much for joining us. I did put a link in the chat. If you do have questions after the fact, please, there's a Google form. You can ask your question, and one of the physicians will get back to you. So thank you so much.
Bye.
Thank you so much, everyone.